Welcome back. So how did Anton Black die? Now you saw it, but it's a question Anton's family had been demanding to know for months. Dateline found out about Anton Black while reporting on a far more famous case, that of George Floyd. During the reporting on this story, Dateline learned that there was one key player who played an outsized role in both cases. Here again is Lester Holt.
4 months after Anton Black's death on his own front doorstep, the autopsy report came out. The manner of death, accident.
It's an accident. You're begging for your life and they don't get off of them. How is it an accident?
The report was co-signed by Maryland's then chief medical examiner, Dr. David Fowler. You'll want to remember his name. It said that while it was likely that the stress of the struggle contributed to his death, no evidence was found that restraint by law enforcement directly caused or significantly contributed to it. The cause of death, it stated, was a heart defect, and a significant contributing condition was bipolar disorder. The day after the autopsy report was released, the county prosecutor announced no charges would be filed.
You took somebody's life and you don't even get charged.
It's kind of like they were exonerated as soon as Anton's autopsy report was signed.
The role of the medical examiner was yet another issue captured in the harsh light of Anton Black's death.
Our role in legal cases plays a huge part.
Dr. Roger Mitchell is a former chief medical examiner for Washington, D.C. Today he's head of pathology for Howard University and an expert in investigating deaths like Anton's that occur in police custody.
He was breathing, running, talking before the fight, and he's no longer breathing, talking, running, and he dies.
From what you've learned from the Anton Black case, what is the proper manner of death?
Homicide. Anton Black was in a fight and lost, and that is a homicide.
Which is not the same as a murder, and it doesn't mean Webster or anyone else committed a crime. Whether they did anything wrong, that's a legal matter.
That is correct.
Here is where Anton Black's case intersects with George Floyd's. When former Minneapolis police officer Derek Chauvin went on trial for murder, his defense called an expert witness.
I was watching it live from my office.
Chauvin's expert was none other than Dr. David Fowler, the same medical examiner who co-signed Anton Black's autopsy report.
Potentially carbon monoxide poisoning.
Dr. Fowler told the jury that despite Chauvin's knee on Floyd's neck, in his expert opinion, the manner of death was undetermined.
So joining me now to talk about the role of medical examiners in determining police accountability is a man you just saw in that clip. It's Dr. Roger Mitchell. Dr. Mitchell, welcome to Meet the Press.
Good morning.
All right. The viewers have seen the death of Anton Black. So let me ask you. I'm going to give you there are 3 basic choices here. Accident, homicide, murder. This medical examiner chose accident. How did he come up with accident?
I'm not quite sure how they came up with accident. I think that there's a philosophy and culture that if there's an altercation with law enforcement, that often if law enforcement didn't mean to kill someone, then it's an accident. But I suggest that it's a homicide, that whether they intended to kill him or not, the actions of another human, whether they're law enforcement or not, those actions that lead to a death are homicide.
That's the technical definition of homicide. It's a death by the hands of another. We don't get into intent.
That's right. That's right. So to answer your question about murder, murder is a legal construct, and that can be determined by your prosecutor, your jury, your judge.
So if you were the medical examiner here, you would have simply labeled this homicide.
Simply.
And so what does that because I think this is what the people don't understand. If you label it accident, the investigation ends? What happens?
Well, some will tell you that the investigation doesn't have to end, right?
Yeah.
It'll say, well, you know, prosecutors can take accidents. They do it with motor vehicle collisions all the time, and they prosecute motor vehicle homicides. But in reality, when the medical examiner calls something accidents or undetermined, a lot of the times the prosecution will not move forward. The investigation will not move forward.
The minute you put in homicide, then it creates urgency, pressure, or is there actually more mandated investigating that has to be done?
Well, that's going to be on the law enforcement, right? Because as the objective forensic pathologist, my job is not to calculate what the effects of my cause and manner are going to be, but merely to call the truth on my cause and manner and ensure that the cause and manner is reliable and reproducible, like any other diagnosis in medicine.
Right. There's a lot of subjectivity into this. And in this report, the medical examiner here, Dr. Fowler, he seemed to indicate bipolar disorder was a cause. How did he come up with that?
Well, it's interesting because David Fowler co-signed this report. So it's not just one medical examiner on this report. There's a more junior medical examiner, and then there's Dr. Fowler. Bipolar is a contributing cause, again, trying to give circumstances of why the altercation needed to occur could be my only assumption.
Well, they think maybe a heart condition developed. Couldn't you have just said that the tasing, they just simply tasing him could have triggered this too? The point is, it's as possible of a contributing factor as the bipolar disorder, no?
Well, the cause of death, it's interesting that you bring that up, Chuck. The reality of it is that cause of death is a natural cause of death. It's a natural cause of death if you just read the cause of death. Yet, the manner of death is an accident. So there's some force that's acting on that natural death. In this case, it's the altercation, and that's why it's a homicide.
All right, let's talk about a bigger picture here, which is we don't know the true number of people that die in custody in America, whether you die in custody during an arrest, die in custody perhaps while you're in jail or in prison, die in custody perhaps in a healthcare facility. It is not on any form, is it?
No, and the reality of it is that in order for us to understand the whole burden of this injury or disease in this country, we need to know how many people are dying. There's a Deaths in Custody Reporting Act that is in law that is not being fully complied with across this country.
We don't have it mandatory in death certificates to check that box or not.
No,
correct?
We don't even have it on a death certificate. So I've been calling for a checkbox on the U.S. standard death certificate merely to say yes or no whether or not a death is in custody. Because yes, Anton Black is terrible, and so is George Floyd. But there are hundreds of people that are dying from natural disease that they didn't need to die from while incarcerated.
Right, we may
That's
find
just
out,
as important.
How about a little better health care at some of these facilities, right? Or something like that. A pharmaceutical help here or something like that, correct? Like this is the type of things we could discover.
Absolutely. In an objective public health measure. The reason why we know about maternal mortality and why women are dying while in childbirth is because there's a checkbox on the U.S. standard death certificate. The reason why we know smoking is contributing to cancers is because there's a checkbox on the U.S. standard death certificate. Motor vehicle collisions, a checkbox on the U.S. standard death certificate.
And yet not in custody. You created this box when you were here in D.C.
That's correct.
And did this. It took you about a year to get everybody. Did you get pushback from law enforcement? Did you get pushback from some?
It's interesting. I work well with law enforcement. Been, a medical examiner for over 15 years. And once we articulated and started educating people about how having this data readily available can help us prevent deaths, people were pretty much on board. So it took me about a year, but we got it done locally. But we need to get it done nationally.
And we don't have time to even get into the whole conversation then. How is it that we can elect these people, elect folks, rather than make sure they have the expert background before they actually become coroners or medical examiners?
We're here to improve a system.
Yeah, that would be one way to do it too. Dr. Mitchell, appreciate it. We will talk to you again soon when we come back.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.